Good afternoon. Welcome to the daily briefing at the St. Clair County Emergency Management Office, where I'm joined with Chairman Mark Kern and the Director of the Health Department, Barb Hope. Barb, you have the numbers for today?
I sure do, gentlemen. Hello, good afternoon, everyone. Hope everybody had a chance to get outside for a little bit because it is a gorgeous, gorgeous day out there. So today we have some good news. Our daily positivity rate for St. Clair County is down to 5.3%. And the numbers to show that, we tested 1,128 folks, and of those, 60 were positive. Again, 60 is still too many, but at least out of all the testing we're doing, it's bringing down our positivity rate. And we're very happy to report we have no additional deaths. So the totals for St. Clair County are, we've tested 54,244 folks, and of those, 5,137 were positive, 49,107 were negative, and we're still at 160 too many deaths in St. Clair County. Statewide, they had an increase of 1,832 positives with an increase of 27 deaths throughout the state. Statewide, we've tested over 3.5 million folks, 3.541,183. Of those, 213,721 were positive, and a total, and this is just disheartening, a total death in the state of Illinois, 7,833 folks. In St. Clair County, the hospitalizations, COVID-related patients in the hospital are 43. That's down from yesterday, which is good, but we still have 2 patients that are on ventilators. Then the updates on the congregate living centers. At Cambridge House in O'Fallon, we have 1 additional case for 3 cases with no deaths. At the Caseyville Nursing and Rehab Center, we have 1 additional case for a total of 27 cases. At the Colonnade in O'Fallon, we have an additional case for a total of 6 cases. And at Four Fountains in Belleville, we have 1 additional case for 110 cases with 27 deaths. As we look at the age breakdown, again, the majority of the folks are age 40 years or less. At least 50% of the positives today, 30 of the 60, were age 40 years older, or 40 years of age or younger. We're really seeing the age of 20 to 29 really peaking the charts of the age groups that are turning positive. So again, please, even though you may seem fine, please wear your mask to help control the spread of this disease. In addition to that, again, as far as testing sites, on a daily basis, and this is weekends too, a lot of people are asking about weekends, the Jackie Joyner Kersey Center is open 8 to 4, 7 days a week. I would call ahead because they say or until supplies last for that day. So Jackie Joyner Kersey Center is open 7 days a week, 8 to 4, and that's in East St. Louis, Washington Park area. Tomorrow we have a drive-through clinic with the Department of Public Health at Moody Park from 8 to 4, Ruby Lane and Longacre Drive. That's a drive-through. Monday and Tuesday, we also have a drive-through at the Swick campus on Carlisle Avenue, both days from 8 to 4, Monday and Tuesday. Also on Tuesday, we'll be south in St. Clair County in New Athens, and that will be from 10 to 12 and 1 to 3 on the beautiful riverfront off the Kaskaskia River in New Athens. And that will be a walk-up, so you have to park, and that will be a walk-up clinic. And then next weekend, next Wednesday and Thursday, we'll be in Eastside Health District areas. We'll let you know where those will be at. And next weekend, Friday, Saturday, and Sunday, we'll be in Madison County. Again, for weekend stuff, for Fridays to be determined. Saturday, they'll be in Granite City at the Coordinated Youth Center. And Sunday, they'll be back at the Edwardsville Administration Building. Again, all of these are all 8 to 4. So a lot of testing sites available. Please get tested. Again, this is our way to identify the disease, asymptomatic or symptomatic folks in our community, and try to restrict folks from spreading it to others. So as Herb always says, be part of the solution. So do your part. Thank you. And with that, I'll turn it over to Chairman Kern.
Thanks, Barb. So, we saw ventilators. We got 2 less on ventilators. Hospitalizations up a little bit, went up 3. But, these numbers are something that we were at 51 for a while, and it actually got higher. We're now kind of seem to be leveling out in the 40s. So let's hope it stays that way.
Yes, when we hope so. And again, we need to get folks tested to be able to identify folks that may be carrying the disease and don't really realize it.
So we were looking at regional positivity is 9.4%, which
Right.
keeps us above the 8, which caused the rollback. But daily, our county positivity, as we calculate through the health department, is 5.3% today.
Yes.
If we go on the state's website, they actually have us pegged at 3.8%. And that's normally, Barb, that's due to the fact that they may look at their numbers at 6 a.m. and we take it as long as we can to prepare those numbers for this program. So about 2 o'clock every day is when your people get together and they get all the numbers, and so that's why our number may be a little off from the states, but we give you the most accurate to the minute number.
Absolutely. Those are the ones we have, and it takes them a little longer than 2 o'clock. But we get a lot of sources. So not only do we get it from the Department of Public Health through our INEDS computer system, the actual lab paperwork is what we look at and what we base our stats on. And but we get it from BJC, from Memorial, from different test sites. So the team has to calculate all that stuff, so it takes a little bit more than 2 o'clock. It's like 8 o'clock in the morning. I got to give them a shout out. They work very hard.
They do, and they're doing a great job. And so I just wanted to make that point that you got people that are on this thing, and you are on the numbers right away. You know when there's something going wrong.
Absolutely, sir. Thank you.
Thank you, Barb. So we'll move into the zip code report at this time. In 62059, we remain today again at 10. 62201 goes up by 1 today to 209. 62203 goes up 1 to 170. 62204 remains the same at 125. 62205 goes down 1 today to 172. 62206 goes up 4 to 377. 62207 goes up 2 to 222. 62208 goes up 1 to 324. 62220 goes up 5 today to 409. 62221 goes up by 2 to 472. 62223 goes up by 5 to 290. 62225 stays the same at 22. And 62226 goes up by 4 to 541. 62232 goes up by 4 to 125. 62239 goes down 1 today to 65. 62240 stays the same at 21. 62243 goes up by 1 to 42. 62254 goes up by 3 to 156. And 62255 stays the same at 14. 62257 stays the same at 26. 62258 goes up by 4 to 100. 62260 goes up by 1 to 88. 62264 stays the same at 72. 62269 goes up by 6 to 391. And 62285 stays the same at 49. So Herb, the regional positivity today is 9.4%, and the state calculates that on a 7-day rolling average. I think it would be interesting today to take a look at what the other counties in our region are doing, just so people have an idea. So St. Clair County today on the state's website, as reported by the Illinois Department of Public Health, shows us at 3.8%. They have Bond County at 4.5%, Clinton County at 17.1%, Madison County at 9.3%, Monroe County at 10.7%, Randolph County at 14.7%, and Washington County at 6.9%. And I think that sends the message that if people think they're going to travel to get away from COVID in this region, we're all in this together, and these numbers are going to fluctuate daily. Some days we'll be higher than we are today. We hope not, but we think that's the way it's been in the past. And we're now seeing our neighbors starting to see these numbers rise. They were pretty low for a long time, but now to see Clinton County at 17.1% sends the message out that we all need to remember that no matter where you are, I don't care if you're out of state, in state, wherever, you should wear your mask, you should wash your hands, you should watch that social distancing. It doesn't just apply here in St. Clair County, but if you have to go elsewhere, it applies there too, right?
And I like what the doctor said yesterday, not only the social distancing, but the physical distancing, which is something that we hadn't heard a lot of, but it makes a lot of sense.
It does.
But I think this also just clarifies what we have been talking about for the last 160 days now, is that we are all in this together. What's affecting one of these counties are affecting all of us, and I'm glad we're able now to start showing those numbers to where our followers can understand that it's just not St. Clair County. You know, we're worried about the entire region because we're all in this together, as we've said from day one. So I'm glad we had that. Another thing I wanted to just mention, I got home late last night, and I even called you about it. My wife was sitting there filling out some of these greeting cards, and I said, what are you doing? And she explained to me she is a volunteer at Touche Regional Hospital, and they've got a program that they're working there where they have taken the long-term healthcare facilities, and they have assigned 100 cards to each of their volunteers to send out to the people in these nursing homes, just letting them know that people are thinking about them. So I wanted to just give a shout out to my wife, Mickey, and then of course the administrator, the volunteer manager down there, Cora Hughes. I talked to her today, and she was really happy that we are going to recognize them for that, because these people in these long-term health cares haven't had visitors since March, other than the nursing staff, and so this is kind of way they're hoping to be able to bring a little smile to their face, let them know.
And what a great idea. And so if anyone out there in Team St. Clair knows someone, and we all know someone in a long-term care facility, drop them a line, send them a card, or even give them a call if you've got the number, because it is a lonely existence to be in a small room in one of these care facilities. And if we get bored, we've got a workshop, we can go in the garage, we can tinker around or cut the grass, which is your favorite pastime. But if you're in a facility, a long-term care facility, congregate living facility, you don't have that option. You really have your room, and most I think are pretty much confined to the rooms. They can't even really walk the hallways like usual.
Exactly. So we want to welcome to our Team St. Clair those volunteers at Touche Regional Hospital for stepping up to the plate and taking the initiative to do that. Speaking of that, I had another member from Team St. Clair send us something last night that I wanted to read today, and it is this. It says, the aspects of our COVID exhaustion are due to the reality that many of us are carrying the weight of others' irresponsibility. Many go about their lives unaffected with any feeling of social responsibility, then feel justified in their carelessness, at least partially protected by the tireless efforts of others. Not only are we carefully navigating a pandemic new to us, sacrificially bearing a collective burden, we have to watch those efforts ridiculed by those who then pretend their carelessness is justified. We're holding a large protective umbrella in a downpour. They're laughing and pretending it's not raining because they haven't got wet yet. It is exhausting to many, but Team St. Clair, we will not give up. We will continue to work with everyone to show the seriousness of this virus, and working together we will be part of the solution, not the problem. We'll be back with Cindy and Daisy in a few minutes to translate this into the Spanish communities, and we'll be back here tomorrow afternoon with the next briefing. Think about that.